I'm gonna videotape this chapter 1 just because this is one we don't have on video, and I always worry if somebody's out or there's a reason we have to do something remotely. We've got it available. We will really monitor this COVID situation. I don't know if you guys watch it. I'm like news junkie. The numbers are out the roof, and South Carolina jumped back up to over 1,600, I think, on Saturday. So we'll really watch it and make good judgments about what we need to do. I want to keep you distanced as much as I can, but I don't want to totally send you home and say learn this on your own. So again, we'll do the best we can to get through this. So we're going to do module 1. In your ring binder on page 4, we already talked a little bit about the certification, what your test will look like, how many years you'll be certified, how to recertify. So the next part of that we're going to jump to is what are the roles and responsibilities of you as a CNA. Now the roles and responsibilities are in your ring binder on page 5, but if you also like to follow along in your textbook, you can turn to that first chapter, module 1 in your textbook, and at the very bottom of that first page on chapter 1, you'll see that it says roles and responsibilities. So this will match up, as I mentioned to you, doing the notes for you and following along. If you'd like to follow along both directions, you can. So at the bottom of that first page in your textbook and on page 5 in your ring binder, we'll talk about it. So it wasn't until 1987 when the federal government got involved and said, we really need to regulate caregivers. There wasn't a CNA role. As I mentioned to you, I was an SNA, and we were taking people that we thought were good at caring for others and allowing them to care for others. They also weren't regulating all of the care facilities. So in 1987, they got together and said, let's create this certified role of a nursing assistant. And for us to get started, let's first establish what do we think that they need to know before we get started. What do we think is important? And that's where they came up with these 3 roles and responsibilities. So the first role and responsibility was promote health. Promote health. And so in promoting health, the thing to keep in mind is what you're going to learn in long-term care has nothing to do with acute care. Here's what I mean. If I break my hip, I'm going to go to a hospital that is an acute care facility to get my hip replacement, my surgery, get my wound managed until they feel as though that I can be discharged medically from an acute care facility. If, however, I am not ready to go home, then I'm going to probably be put in some sort of transitional care or restorative care while I continue to get better in hopes that I'll go home. And if I can't get better, I no longer can bear weight on that leg, I'm just weak, then you're going to end up in a long-term care facility. But the goal is you arrive there while healthy, not while sick. So you're in the facility, everybody in theory is healthy, all of a sudden you get pneumonia. Well, if it's bad enough, you're shipped back out to the acute care facility for the pneumonia until you're stabilized and can come back to the facility. So when they came up with this first guideline of promote health, they wanted CNAs to, hey, when you're taking care of these people, let's keep them healthy. Like if they can walk, let's get them up and walk them and make sure and get that circulation going and their oxygenation. If they can't get out of bed, let's turn them every 2 hours. Let's make sure they don't get bed sores. If they're having trouble with food and hydration, help them. Let's give them food and fluid to keep them hydrated and keep their nutrition up. You're trying to maintain a healthy situation. Because again, I hate that you're missing a clinical opportunity, but if you were there, the reason these people are there is they no longer can provide their own care. It's nothing more than that. They've had a stroke and maybe they lost function on one side of their body. They have dementia or Alzheimer's. They cognitively cannot process things safely. So these are not sick individuals. So we need to do everything we can to promote health. The second one that's on that list is to reduce harm. What do you think is the #1 harmful event in a facility? Falls, absolutely. So our residents are huge fall risks with mobility, and so they fall. Usually the #1 bone that's broken is the hip, sadly. That shoots them over to the acute care hospital for care, and I'm telling you, when they come back, they're just not going to rebound or recover like we could. So trying to keep them from doing that. You'll also find it interesting when you start working in healthcare, in long-term care, Side rails are a restraint. So you may not restrain your patient's movement, meaning that grandma can be in her nursing home bed with no side rails up. You say, well, she's gonna fall. Well, she might. We have to come up with other ways to help her. Let's take the bed and put it all the way in the lowest position. Let's take some pads and put them on each side of the bed. So if she rolls off, it's cushions that fall. If I'm walking with her, it might be safer for me to use a transfer belt or gait belt, which we'll learn more about. And I will kind of guide her and walk with her. But I'm doing everything I can to prevent her from falling and having a harmful event. And then the third thing that they wanted to do is they wanted means to try to control infection. And I don't just like the word the control, I wish we could say prevent. But the reality is we're not in a situation where we can prevent infection. So we want to try to control it. Many of you have seen at nursing homes or even hospitals during winter months, it'll say, before COVID even, it'll say, if you have a cough or fever, please don't come visit your family member, we're in the middle of flu season. Okay, another type of illness where we're trying to control the spread of that virus during flu season. Right now we're obviously seeing a lot of that. So once they came up with these 3 primary roles, everybody was happy with it on this committee. They said, okay, we've got that now. Now what skills do they need to have to carry out those roles? So they said, okay, what can I do, what can I teach them for promoting health? Well, one of the things you're going to learn is a skill called positioning on side in the bed. Well, if I'm positioning them and turning them, I'm promoting healthy skin. Right? Reducing harm. You're going to learn a skill that says ambulate, which means to walk, a resident with a gait belt or transfer belt. I'm holding on to something while we walk so that if we stumble, maybe I can catch the force of the fall. You're going to learn hand washing, and that's to control infection. Right? All right, now let's add a couple others and see if we can determine where they would go. What about teaching you to put on and take off personal protective equipment, which is like gloves and gowns? What do you think? Where should that one go?
Reduce, number 3.
Okay, it would reduce harm to the caregiver, but the idea is to control the infection for the client. Right, so you're going to learn personal protective equipment. All right, I'm going to teach you to apply elastic stockings or compression stockings. Where do we think that's going to go?
Promote health.
Yeah, I want to promote health. I do not want you to get a blood clot, have the swelling in your legs. I'm going to put these compression stockings on and I'm going to keep that from happening. Well, sadly, you're not able to walk anymore, but I'd like to help transfer you from the bed to the wheelchair safely.
Reduce harm.
Reduce harm, okay? So we're going to learn transfer skills. So you guys get the idea. So we have these skills in our skill book, 22 skills, and all of them were geared around one or more of these categories. Range of motion promotes healthy movement of extremities, okay? It also prevents contractures. So some of them do overlap, but that's how all of this came to be. That's how all of the guidelines that were established initially came to be. And they've changed things a little bit, but for the most part, the skills you learn are focused on one of those 3 things. Now, the reality is you can't do all of this. You've got to have other people that help you with this process. This is hard, taking care of residents in a long-term care facility. It's basically all the skills you might be doing with a baby, but they now weigh 200 pounds. And so the challenges you have with that, and then there's other challenges that you have. So what I'm going to do is I'm going to pass out a card to each of you. And on the card is going to be the new position that you hold at the facility. And you can take the card and look at the position you hold, and then you can turn it over and we'll talk about what we're going to do with that. So I'm going to make you the registered nurse. You are the dietitian. You are the activities director. You are the mental health worker. You're the CNA. And you're the nice family. You're the pastor. You're the social worker. You are DHEC. You are the LPN.
Nice.
And I'll hold on to the last 2 to do these. I'm the resident and the physician, okay? So in your, again, textbook, if you're following along, it's the next page over on your ring binder. It's the bottom of the current page that we're on. But we identify these team members and we decide, how are are they gonna help us? You know, what can they do to make this a better situation? Well, the first thing you have to do is you have to have a resident. So I've got the resident card. Because if there's no resident, there's no job. And on the back of my card it says, there is a South Carolina Bill of Rights that protects me and my care. True or false? What do you guys think?
True.
It is true, okay? It was very important when all this was established to not take these patients' rights away from them. Are there times that somebody has to take over some of the decision making? Absolutely. But there are certain rights that they have in the care. When we do chapter 2, I've actually put a copy of that law in your ring binder. We'll cover it more in chapter 2. But it tells you what you should be doing in terms of caring for elderly and respecting their rights. Okay, so that's our resident, first of all. Okay, so the next one, who has our CNA, our Certified Nursing Assistant, okay? What does yours say?
I spend the most time with the resident, true or false.
Okay, I spend the most time with the resident, true or false? What do you guys think?
That's true.
That's absolutely true, okay? That's what this role was designed for. We needed an entry-level individual that could be there to care for the resident, but you know the most about them. You know when you've gone in and their level of alertness is off. You know when you've had them all shift and they haven't had a wet brief or had a bowel movement. You know when you fed them that they refused their breakfast or lunch. You have the big picture of this patient more so than anybody on the team. Now here's where I struggle. Most of you are going to go get a job, we'll give you a little bit more money than that, as a CNA, once you're certified, and probably be looking at about $11 entry. Oh my gosh, guys, I can go to Chick-fil-A and smile and make $13 an hour. I can go to QT gas station and be a manager and make $45,000 a year with benefits. So the first problem we have is we have not valued this role whatsoever. So here I am in class. I'm going to train you in 100 hours of care. I'm going to give you a whopping $11 an hour, and you're going to have to know more about my grandma than anybody in the healthcare team. Does that make sense? It doesn't, okay? And this is where when you guys think about watching people a revolving door, or when you guys start working and you realize you got your choice of working anywhere you want because the turnover is so big that you can just keep going from job to job to job, it's there. It's because it is hard to retain a quality CNA at this, right? Oh, well, we'll put you on some shift differential. That'll help you out a little bit. Well, it might, but that's not helpful, okay? It's not helpful enough. So many people, too, are dealing with being single parents and trying to manage on this. So it's very, very difficult. And there's been a lot of discussion about why are we not paying them more? Part of the reason we're not paying them more is that unfortunately most of these facilities are for profit. So if they can get by with caregivers that are willing to work for this amount of money, it's more profitable for the owners or the people that are maintaining the facility. So that's a super, super broken process to that. All right, the next level of person in this chain of events is the LPN, the licensed practical nurse. Who has the LPN? Okay, what you got?
That's me. I spent most of my shift passing medications, true or false? That's actually true.
Okay, I spend most of my shift passing medications, true or false? The answer is true. So an LPN is a licensed practical nurse. Now we're going to give them a little bit more money an hour. They're going to have a little bit more training involved, but they're going to be primarily passing the medications because this individual doesn't have enough knowledge of that. The LPN gets more of the critical thinking, more of the physiology, so that's where they created that role. Again, if you've paid attention at all, most hospitals won't hire LPNs anymore. And so most of these LPNs that end up finding a job, finding them in long-term care. And that's many times the best that they can hope for. So here's our LPN passing pills, and here's our administrator going, gosh, you guys, do we really have to pay an LPN $16 an hour to pass these pills? Surely we can come up with a smart CNA that we could train a little bit more hours, and they could pass the pills, couldn't they? Well, here it came. I already heard somebody in the room talking about it. Med tech. That's how that came to be. And so you go to work for a facility, and Candace gets a job at the facility, and they go, oh, she's so good, she's so sharp. Man, why don't we see if she wants more training? So you go and say, listen, I have an opportunity for you to be a med tech. I think you're so smart, I think you're capable of it. you would get a raise for doing that job, and we'll raise you to $12.75 an hour, and we're gonna pay for your training, which on the average, I'm not kidding you, is 8 hours, and then we're gonna let you pass the medications. How scary is that? I mean, that's really scary. Now, do I understand that the meds come in packets, and they're pre-dosed, and they're punch out, and all, but that's not what passing pills is all about. I need to know that that medication I just gave, called metformin, that was in that nice little pop-out box that I'm supposed to be giving every morning and evening, I need to know that that affects blood sugar. And now, am I trained enough as this med tech or CNA to do a finger stick blood sugar before I manage that medication? And so the amount of training that went into play really, again, was a disservice. But people were very happy to eliminate this dollar amount and be able to get by with the same role in a much less dollar amount. And again, this is going on everywhere, assisted living, everywhere. I mean, several of you said you've done it.
Even the CNA portion, they can't even do point of care, is that correct?
That's correct.
So.
Right, and point of care would be like a blood sugar, yeah,
Blood sugar,
exactly.
correct, yeah.
Exactly. So yeah, it creates a huge dilemma. So the next person then would be the registered nurse. Who has the registered nurse, okay?
Okay. I will be in the building at all times.
I will be in the building at all times, 24 hours a day, 7 days a week, because you do need a higher thinker provider. What do you think?
Negative. That's false.
Negative, okay? Now, I will tell you the design originally, the original design was there must be one RN in the building 24/7. Because the RN might have to get an IV started, an RN might have to administer drugs in an IV, an RN might have to assist with airway management. Those are beyond what an LPN can do, and they're definitely beyond the med tech. And so they established that. Well, again, we came into play with our powers that be, and they said, oh, I don't know, about $21 an hour. Now they're 2 years or more, associate degree or more. And do we really need them in the building 24 hours a day, 7 days a week? And so again, we got creative and said, no, let's be realistic. 8 to 5, Monday through Friday seems pretty good. We can make sure. And then we're gonna make them on call 24/7. So you have a registered nurse available to you, but they are not necessarily in the building. By golly, we saved a whole lot of money again, all right? So that became kind of a troublesome decision. Well, then we go further up the chain, and we've got our next level, which is our physician, our MD. Okay, I've got that card. And it says, I will come see you every day and make rounds.
Once a week, maybe.
That is not a true statement, okay? Now, if you are in the hospital at Spartanburg Regional, Prisma, you're in the hospital acutely, that physician or resident is probably coming by twice a day, because the faster they can get you out of there and turn the beds over, the better they are. So then they're making rounds morning, they're making rounds evening. That's very different, because remember, in long-term care, I'm now healthy. I'm just in my new home. So now the doctor is gonna come many times once a month, or sooner if a nurse calls with a concern, or there's something acutely going on that they're monitoring very closely. So now we have our physician. We'll give them lots of credit. They've got 9 years plus of schooling, so we'll give them credit for that. 4 years undergraduate, 4 years med school, at least a year of transitional residency. And we're gonna ask you to be the medical director of our facility and pay you $250,000 a year.
That's easy.
Pretty sweet,
Absolutely.
pretty sweet. So, you know more about the resident with the least amount of training and money. They know the least about the resident with the most amount of money. Again, I know there's a lot of training involved and probably a lot of debt. But this is not just in long-term care, like this is across the whole spectrum. Like when I worked in the ER, you know, a tech would usually get the patient and do the vital signs and place them in the room and put them in a gown. And then I, as the nurse, would come in and maybe do the assessment. And then I'd put the chart in the doctor box and they'd go in and do it. And then they'd drop it back in there with orders for IV, meds, lab. Somebody else would do that. This individual typically spending the least amount of time with the patient through this whole process. So we gotta be really careful not to depend on them to pick up and know the things that we know. Again, we've got to figure out a way to value this. It'll never be that, don't get me wrong. We got to do something here. I mean, there's no amount of love that I have, unfortunately, that I could work for that in that scenario in a nursing home, taking care of 10 clients. I couldn't do it. And so how are we expecting people to do it and be passionate and love their job? All right, let's look at a couple other of the team members. Let's find DHEC. DHEC, all right, what's it say? DHEC, Department of Health and Environmental Control.
It says, I will inspect your facility every 3 months.
Okay, I will come and inspect your facility every 90 days, every facility in the state to make sure everything's good. What do you think?
Negative, false.
Negative, all right? I would love if they came every few months. I would love if they came every 6 months. I'd love if they came every year. But they now are typically on a 12 to 15 month rotation to check your facility. Now here's what's worse. I'm the director of the facility. Hi, this is DHEC. I just want to let you know your DHEC window is December 1st through December 31st. Thank you, DHEC. Hey guys, DHEC's going to be in the building in the month of December. Let's get ready. Okay? Let's get everything cleaned up. Let's get everything where it's supposed to be. Let's make sure all our charting's done. Let's cover all our bases because they're coming during those days. Well, you know, that's like you guys telling me, if you told me today, can we go eat at your house today, Karen, for lunch? I'm going to say, no, we're not eating there today. My dad's just left. There's dishes in the sink. We had a big dinner last night. No, we're not going there. But if you say, well, maybe next Monday, can we go have lunch maybe on break at your house? My house is not going to look anything like it looks right now because you're coming, and I can fix all that before you get there. So again, I'm troubled by that process. Now, if something's wrong and they write you a ticket or a citation, then they give you 3 months usually to fix that variation, and they come back at that time frame, but then they're only looking for the variations. They're not going back and reassessing everything, okay? So it's like now if you come to my house and I cleaned up the downstairs, but I shut the doors upstairs and the bedrooms closed, so you don't look at that. You're just going to look at what you came to look at. So good people work for these organizations. Please don't get me wrong, but the job and the task that they've been given is virtually impossible, and it makes it really, really tough. All right, who's got the dietitian? Dietary, what you got?
I do not eat pork. Can you prepare my meals without it?
Okay, we'll assume you practice traditional Judaism and you don't eat pork. Should the nursing home prepare your meals without pork?
Yeah, absolutely. Yeah.
I think they should. I think that's a cultural or religious norm that we ought to try to respect. All right, now I'm almost 62. I ratted myself out on how old I am. So I'm not going to be able to answer this question in 30 years. You young girls that are in here, think about this for a moment.